They say the eyes are the windows to the soul, which must mean your eyebrows are the frame. Just ask Hollywood's most in-demand facial surgeon, Dr. Jason Champagne, great name, who seems to have mastered that perfect look.
A-listers like Chrissy Teigen have been seeking out his signature champagne eyebrows for years. The style fast becoming the latest Tinseltown trend. And Dr. Jason Champagne joins us live from LA. Welcome to the show.
Hi, good morning.
Hi, you've become quite the go-to in Tinseltown. Did you ever think you'd become the one that the celebrities are turning to like this?
I've always had that goal, but, you know, I can say that I'm pleasantly surprised that I was actually able to make it happen.
OK. Now, explain how your signature champagne eyebrows procedure works. What's with that?
So, for patients who have thinned over time or over-tweezed, I borrow hair from the back of the head, and one by one, myself and my team transplant those hairs into the eyebrow region after I've created a shape along with the patient's guidance to help balance the face, to frame the eyes, and then we come back in place one by one hair in each hair follicle into the eyebrows to permanently reshape the brow and rebuild the brow.
Well, so this is what men have been doing with their, hair for ages, but now it's kind of just come down onto the eyebrows for mostly women, I guess. Is this fuller brow look here to stay?
I hope so. I hope so. Every single patient that I've treated has always said that their biggest regret was that they over-tweezed their brows, many of them in the 90s when it was really popular, and they always say, I wish I had never done that. I tell my daughters, don't tweeze your brows. So I hope that this is here to stay. So ladies, men too, don't tweeze your brows because sometimes they don't grow back and then you may end up in my chair.
Good tip. Now, it's not only women seeking out your services. For men who are balding or have thinning hair, you have a solution for that as well, asking for a friend.
Absolutely, absolutely. So, as you mentioned earlier, hair transplantation in the early days started out for men on the scalp, but I transitioned that into the eyebrows and created my own champagne brows procedure. But yes, men absolutely are candidates for hair transplantation if they're thinning, for male pattern balding reasons, and also for eyebrows. I've actually performed my champagne brows procedure on many men as well.
Okay, so this is your own hair getting just put into a different spot on your face. So it's not somebody else's hair, it's your hair?
Not at all. It's your own hair, and it's a permanent result. The thing to know about the procedure is that because it's hair from your head, it does grow like it's on your head and needs to be trimmed maybe once or twice a week. However, it looks extremely natural when done by the proper surgeon.
You don't want to be plaiting your eyebrows.
Don't plait your eyebrows, no. Well, what if, hypothetically, I wanted to get the eyebrows done, but I don't have enough hair on the back of my head. Could I borrow some of Kylie's hair to do my eyebrows, and would that keep growing in my head? Because that'd be weird.
No, you cannot. Okay. It's just like any other organ transplant. You have to. It has to be yours for the hair to work, because organ transplants, those patients need to be on immunosuppressants to keep that organ alive and from your body from rejecting it. However, for hair, that's not something that you should do.
Yeah, your body would reject my DNA. What kind of risks are involved in these type of surgeries? Because there's always risk.
Very minimal, actually. The main risks would be of any surgery, and specifically for this procedure, minor bleeding, minor pain, an infection, for which I give antibiotics to all of my patients just for the day of the procedure, and scarring. The scarring is specifically in the back of the head where I borrow the hair. However, I tell all of my patients in my hands it should be a very thin, perfectly created incision line that even your hairstylist should never even see.
Wow. OK. Now, other than the eyebrows, we see other facial trends for things like bigger lips and Botox. People still talking about that a lot. What are the most popular requests coming your way right now?
I think right now what we're seeing is a transition into more non-surgical, minimally invasive procedures in my office. And I think this is across the board what we're going to be seeing in the future. More and more younger patients are being proactive and want to be preventative as far as their aging goes. So more skin care. Botox is a big part of that. Very conservative filler is still appropriate. I know recently filler has become a big topic because you know, a lot of people are seeing that maybe it's been overdone, and that's certainly true. However, in the right hands, especially a facial plastic surgeon like myself who understands the anatomy, a conservative amount of filler is still appropriate for enhancement. But I'm always thinking long term. You know, all of my patients, I'm thinking, what is your 10-year plan? What's the future going to look like? So I approach every patient in that way.
All right. Well, lovely to talk to you this morning. Thank you for the warning about trying to transplant Kylie's DNA into my head. I appreciate that. Thank you to the doctor in Hollywood with the best name in the world, Dr. Champagne. Good chat.
Thank you
so much, Doctor. Fascinating stuff. Thank you.